Most people taking lisinopril are doing something harmful without realizing it. Not because they're careless, but because nobody told them. Their doctor prescribed the medication, maybe mentioned a few side effects, and sent them home. What didn't get covered was the list of things that quietly work against it, or worse, turn it into something dangerous. That's what this video is about. 8 specific combinations that can cause real harm when you're on lisinopril. Some are obvious once you hear them. Others will genuinely surprise you. Let's start with the one that sends the most people back to their doctor with worsening blood pressure and declining kidney function. Ibuprofen, naproxen, Advil, Aleve. Whatever you call them, they fall into the same drug class, NSAIDs, or non-steroidal anti-inflammatory drugs. These are some of the most widely used over-the-counter medications in the world. And for people on lisinopril, they're a serious problem. Here's what happens. Lisinopril works partly by relaxing the blood vessels that feed your kidneys. That helps your kidneys filter properly and keeps your blood pressure under control. NSAIDs do the opposite. They cause the blood vessels around your kidneys to tighten. When you take both together, you're pulling in 2 different directions. Your kidneys take the hit. Over time, that strain can damage kidney function. And your blood pressure? It goes right back up, as if the lisinopril isn't even working. If you're dealing with pain, talk to your doctor about alternatives. Acetaminophen, Tylenol, is generally safer to use alongside lisinopril for most people. It doesn't carry the same kidney risk. That simple switch matters more than most people realize. Now for something that surprises almost everyone. Potassium supplements. Lisinopril already raises potassium levels in your blood. That's one of its known effects. Add a potassium supplement on top of that, and levels can climb too high. When potassium gets too high, it affects how your heart beats. Muscle weakness, an irregular heartbeat, and in severe cases, dangerous heart rhythm problems can follow. This doesn't just apply to supplements in pill form. Certain protein powders, electrolyte drinks, and even some multivitamins contain meaningful amounts of potassium. If you're on lisinopril, check labels before adding anything new to your routine. The next one is closely related, and it trips people up more often because it's marketed as a healthy choice. Salt substitutes. Many people who are watching their blood pressure switch from regular salt to low sodium or no sodium salt alternatives. These products replace sodium with potassium chloride. They taste similar. They seem like the smarter option. But they're essentially a concentrated potassium source. For someone on lisinopril, that combination can push potassium to dangerous levels just as quickly as a supplement would. Now let's move on to something that affects people socially as much as physically. Alcohol. A glass of wine or a beer with dinner. For most adults, this feels harmless. But alcohol lowers blood pressure. So does lisinopril. When you combine them, the drop can be significant. You might feel dizzy when you stand up, lightheaded, or even faint. For older adults especially, that kind of sudden blood pressure drop increases the risk of a serious fall. Beyond that, regular alcohol use makes blood pressure harder to control overall, which works directly against what lisinopril is trying to do. This doesn't mean one drink is an emergency. But drinking regularly while on this medication makes it harder for the drug to do its job consistently. Number 5 involves a specific class of medications that doctors sometimes prescribe alongside lisinopril, which makes this one worth understanding carefully. Potassium-sparing diuretics. These include medications like spironolactone and amiloride. They're water pills, but unlike standard diuretics, they hold potassium in your body instead of flushing it out. That sounds fine in isolation. But combined with lisinopril, which also raises potassium, you can end up with a serious buildup. The combination isn't automatically off limits. Sometimes doctors prescribe both intentionally and monitor potassium levels closely. The problem arises when patients are started on one without the other being adjusted, or when monitoring is not done regularly. If you're on both, make sure your potassium levels are being checked. Now this one is important for anyone managing a mood disorder. Lithium. Lithium is used to treat bipolar disorder, and it requires careful monitoring because the difference between a therapeutic dose and a toxic one is small. Lisinopril interferes with how your kidneys clear lithium from your body. That means lithium can build up to higher than intended levels. Lithium toxicity isn't subtle. It can include confusion, tremors, nausea, and in serious cases, damage to the nervous system and kidneys. If you're on lithium and your doctor is adding lisinopril, or the other way around, both medications need to be managed together. Lithium levels should be checked after any change to your lisinopril dose. Number 7 is one that affects a large portion of people on lisinopril, since heart disease and type 2 diabetes so often travel together. Diabetes medications, particularly insulin and certain oral drugs that lower blood sugar. Lisinopril can enhance the blood sugar lowering effect of these medications. That might sound like a good thing, but it means your blood sugar can drop lower than expected. Hypoglycemia, low blood sugar, causes shakiness, sweating, confusion, and in severe cases, loss of consciousness. This does not happen to everyone, but it's most likely to occur when someone has just started lisinopril or when the dose is changed. If you're managing diabetes alongside blood pressure, your glucose monitoring becomes even more important during those transition periods. And the last one. This is an antibiotic that many people take without a second thought. Trimethoprim, found in a common antibiotic combination called Bactrim or Septra, often prescribed for urinary tract infections. Trimethoprim blocks the kidneys from releasing potassium. You already know that lisinopril raises potassium on its own. Put them together, and potassium levels can spike significantly, sometimes fast. Studies have shown that people on ACE inhibitors like lisinopril who are prescribed trimethoprim have a notably higher risk of hospitalization for potassium-related heart problems. This isn't rare, and it's not something most patients or even all prescribers think about automatically. If you're prescribed an antibiotic for an infection, mention that you're on lisinopril. Your doctor may choose a different antibiotic or monitor your potassium during the course of treatment. So let's bring this together. 8 combinations that can undermine your medication, strain your kidneys, raise your potassium to dangerous levels, or drop your blood pressure too low. NSAIDs, potassium supplements, salt substitutes, alcohol, potassium-sparing diuretics, lithium, diabetes medications, and trimethoprim-based antibiotics. None of these are meant to make you fearful about taking lisinopril. It's an effective and well-studied medication. But it works best when the people around it are paying attention. That means keeping your doctor informed about every medication, supplement, and significant dietary change. It means reading labels on things you wouldn't expect to matter. And it means asking questions when something new is prescribed. Your pharmacist is one of the most underused resources you have. Before starting anything new, ask them directly. Does this interact with lisinopril? That one question can prevent a problem that might otherwise take weeks to diagnose. The people who do best on this medication aren't the ones who take it passively. They're the ones who understand it. And there you have it. Take this knowledge and take control of your health. Thank you for watching.